Why is subclinical hyperthyroidism hard to diagnose? Imagine feeling perfectly fine but having a hidden thyroid imbalance that's difficult to spot. That's the challenge with subclinical hyperthyroidism. It's a condition where the thyroid is slightly overactive, but you might not notice any symptoms at all. The main reason it's so tricky to diagnose is because the signs are often absent or very subtle. Instead, doctors find it through routine blood tests that show a low or suppressed thyroid-stimulating hormone level, while the actual thyroid hormones, free T4 and T3, stay within normal ranges. Since there are no obvious symptoms like weight loss, rapid heartbeat, or heat intolerance, doctors usually only discover it during checkups or screening tests. Another factor that complicates diagnosis is the sensitivity and variability of the tests used. The key test measures how much thyroid-stimulating hormone is in your blood. For an accurate diagnosis, the test needs to be very sensitive, able to detect tiny changes. But sometimes, lab results can be affected by factors like interference from supplements such as biotin or other substances, leading to false readings. Different labs may also have slightly different reference ranges, which can make interpretation confusing. Because of this, a single abnormal result isn't enough. Doctors often recommend repeating tests over several weeks or months to confirm whether the low TSH is persistent or just a temporary fluctuation. TSH levels can also be temporarily suppressed due to other reasons that aren't related to thyroid overactivity. For example, illnesses unrelated to the thyroid, certain medications, or recovery from thyroiditis can cause TSH to dip briefly. Distinguishing these transient causes from true subclinical hyperthyroidism requires careful monitoring over time. This means doctors might order multiple tests to see if the low TSH persists, which adds to the complexity. The causes of subclinical hyperthyroidism are diverse. It can result from autonomous nodules, early stages of Graves' disease, or mild thyroiditis. Sometimes these different causes overlap with other thyroid issues, such as nodules or even incidental findings of thyroid cancer. This diversity makes it harder to pinpoint the exact reason for the abnormal labs, especially since symptoms are often missing or very mild. Since subclinical hyperthyroidism usually doesn't cause symptoms, routine screening isn't common for everyone. It's often found incidentally during tests for other health issues or in people at higher risk, like older adults or those with heart problems or osteoporosis. This means many cases go unnoticed until further testing is done. Finally, some patients have a form called T3 toxicosis, where only the T3 hormone is elevated and TSH is low. This can be an early or mild form of hyperthyroidism that might be missed if only T4 is checked. Because of all these factors, the subtle lab changes, lack of symptoms, test variability, and multiple possible causes, diagnosing subclinical hyperthyroidism requires careful, repeated testing and sometimes imaging studies like ultrasound or radioactive iodine scans. These tools help identify if there are nodules or other autonomous thyroid tissue causing the imbalance. In summary, the absence of clear symptoms, the subtle and sometimes fluctuating lab results, and the variety of underlying causes make diagnosing subclinical hyperthyroidism a real challenge. It's essential to work closely with healthcare professionals who can interpret these findings carefully and decide on the best course of action. If you suspect any thyroid issues, always consult a doctor for personalized advice and proper testing.